The Medicare program consists of several parts: Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. Let's take a look at what each of these parts covers. We often call Medicare Part A hospital insurance. Part A helps pay for inpatient hospital care, inpatient care in a skilled nursing facility, SNF, after a covered hospital stay, some home health care, and hospice care. Please note, for each service Medicare covers, your patients must meet coverage and eligibility requirements. This applies for all parts of the Medicare program. Medicare Part B, often called medical insurance, helps pay for several additional services including physician services, some preventive services, home health for patients without Part A, ambulance, laboratory and diagnostic services, surgical supplies, durable medical equipment, prosthetics, orthotics, and supplies, hospital outpatient services, and services from a practitioner with a limited license, including audiologists, certified nurse midwives, certified registered nurse anesthetists, clinical nurse specialists, clinical psychologists, clinical social workers, independently practicing occupational therapists, independently practicing physical therapists, independently practicing speech-language pathologists, nurse practitioners, and physician assistants. People often refer to the combination of Medicare Part A and Part B as Original Medicare or fee-for-service. Note, if you are a healthcare professional and you want to accept Medicare payment, you have to enroll in the program. To enroll in Medicare, visit the CMS website at cms.gov, click on Medicare, and scroll down to Provider Enrollment for more information. Medicare Part C, which we often call Medicare Advantage or MA, is another option Medicare beneficiaries can choose. MA plans are private insurance companies Medicare approves to offer benefits to our beneficiaries. MA plans must cover all services that Medicare Part A and Part B cover, with the exception of hospice care. In addition, MA plans may offer additional benefits that traditional Medicare does not pay for. Note, if you provide services to a beneficiary who has enrolled in an MA plan and you do not have a contract with that plan, you should still send your bill to that plan. However, you should inform the beneficiary that he or she may be responsible for all the charges. Medicare Part D is the Medicare prescription drug benefit. Beneficiaries may choose to enroll in one of these plans since they cover a variety of drugs that Original Medicare does not. Medicare approves insurance plans or private companies to provide these services. Each plan can vary in cost and what they cover.